Bismillahirrahmanirrahim. Today lecture is about hypertension. Hypertension means high blood pressure. And this lecture is mostly related with the essential hypertension. In this lecture I will discuss the essential hypertension. Hypertension, also known as high blood pressure, is a long-term medical condition in which the blood pressure in the artery is persistently elevated. High blood pressure usually does not cause symptoms. It is, however, a major risk factor for stroke, coronary artery disease, heart failure, atrial fibrillation, in which saw teeth-like structure appear in the ECG graph, and QRS complexes are irregular. Peripheral arterial disease, vision loss, chronic kidney disease, normal kidney, and a disease kidney and dementia, in which loss of memory occur. Hypertension is a major cause of premature death worldwide. Identifying hypertension. The American Heart Association (AHA) trusted source stated that most people who have hypertension do not experience any symptom. They enjoy normal life. People usually discover that they have hypertension following a routine blood pressure check. A blood pressure reading will display a number representing two different types of blood pressure, systolic and diastolic. Systolic, the number appear at the top represent the maximum pressure heart exerts when beating. Diastolic, this number appear at the bottom. It represents the amount of pressure in arteries between heartbeat. During diastole, the pressure in the vessel is called diastolic blood pressure, and when the heart is in systole or contracting, so the pressure in the systemic circulation or aorta is called diastolic blood pressure. Categorizing blood pressure. The American Heart Association trusted source categorized blood pressure reading according to the following parameters. Normal systolic is below 120 and diastolic is below 80. Elevated systolic is 120 to 129 and diastolic is between 80. Hypertensive stage 1 systolic is 130 to 139 or diastolic is 80 to 89. Hypertensive stage 2 systolic blood pressure is 140 or higher or diastolic is 90 or higher. Hypertensive crisis. Systolic is higher than 180 millimeter of mercury or diastolic is above 120 millimeter of mercury. A hypertensive crisis is a medical emergency and a person requires immediate medical attention to prevent severe complications. Ambulatory blood pressure monitor over a 24-hour period appear more accurate than office-based blood pressure measurement. Hypertension is around twice as common in diabetic. High blood pressure and diabetes are both aspects of metabolic syndrome and often occur together. Possible reason for this may be that they have similar risk factor or that high blood sugar level damage cell in cardiovascular system. Association of diabetes with hypertension. A person with diabetes either does not have enough insulin to process glucose or their insulin does not work effectively. Insulin is an hormone that enables the body to process glucose from blood and use it as energy. When a person has insulin problem, glucose cannot enter their cell to provide energy, so it accumulates in blood stream instead. High blood glucose level can cause widespread damage to tissue and organ, including those that play a key role in maintaining healthy blood pressure. For example, damage to the blood vessel and kidney can cause blood pressure to rise. Classification of high blood pressure. High blood pressure is classified as primary essential hypertension, secondary hypertension. About 90 to 95% of cases are primary, defined as high blood pressure due to non-specific lifestyle as genetic factor. Lifestyle factors that increase the risk include stress, in which there is increase in the adrenaline and noradrenaline, which cause increased rate of the heart. Increased rate cause increased pumping of blood into systemic circulation, and in this way increase the blood pressure. Excess salt in the diet, excess body weight, drinking too much coffee and other form of caffeine. Family history of high blood pressure, smoking, physical inactivity, and alcohol abuse. The remaining 5 to 10% of cases are categorized as secondary high blood pressure, defined as high blood pressure due to clearly identifiable cases such as chronic kidney disease, narrowing of the kidney arteries, and endocrine disorder, or the use of birth control pills. Lifestyle change and medication. Lifestyle change and medication can lower blood pressure and decrease the risk of health complication. Lifestyle changes include weight loss, physical exercise, decrease salt intake, reduce alcohol intake, stop smoking, and healthy diet. Changing from junk food to healthy diet which contain more vegetable and fruit and pulses. If lifestyle change are not sufficient, then blood pressure medication are used. Sign and symptom. Hypertension is rarely accompanied by symptom, and its sign and symptom. Hypertension is rarely accompanied by symptoms, and its identification is usually through health screening or when seeking health care for an unrelated problem. Some people with high blood pressure report headache, particularly at the back of the head and in morning, as well as lightheadedness, vertigo, tinnitus, or hissing in the ear, altered vision, or fainting. Sign and symptoms. On physical examination, hypertension may be associated with the presence of change in the optic fundus seen by ophthalmoscopy. The severity of the change, typically of hypertensive retinopathy, is graded from 1 to 4. Grade 1 and 2 may be difficult to differentiate. The severity of the retinopathy correlates roughly with the duration of severity of the hypertension. Medication. Up to 3 medications taken concurrently can control blood pressure in 90% of people. The treatment of moderately high arterial blood pressure, defined as 160 over 100 millimeter of mercury with medication, is associated with an improvement life expectancy. High blood pressure affects between 16 and 37% of population globally. In 2010, hypertension was believed to have been a factor in 18 of all deaths, 9.4 million globally. As usual, I have added MCQ. Please read the stem. Which of the following is a correct list of established risk factors for hypertension? The correct option is in B, increased age, female sex, and menopause. So thank you. Please subscribe the channel and Don't forget your valuable comments for the improvement of the channel.